Morning. So today we will continue with our next concept, and this concept is slightly longer and has a potential for NEET next, and USMLE is also very fond of asking questions on this. This gives a lot of scope for simple numericals. These are called indicators of health. Now I was yesterday only looking at the textbook, and textbook has taken or discussed this subject in 11 pages. So that is hell of a lot. So at least I deserve at least half an hour. First of thing we have to understand or learn in indicators of health is the characteristics of a good indicator. Now I will combine the two chapters. Probably you must have read chapter on screening of diseases, which has got few indicators for the test of the screening test. These indicators, if you remember or you will learn later, are validity, sensitivity, specificity, reliability, acceptability, and feasibility. We can apply same knowledge here. So a good indicator should be valid, it should be sensitive, it should be specific, it should be reliable, it should be relevant, and it should be feasible. So remember or just understand that the same principles are there. We will study the details of these characteristics when we do screening of diseases. What are the uses of indicators? Why we need indicators? Obviously, now we are discussing health, so we need indicators to measure health of an individual and community, because we are community medicine people, so we want to study the health of a community. Now what are the uses? The uses are same or similar or can be learned with what are the uses of or aims of epidemiology. The aims of epidemiology are, when we will study epidemiology or we have studied epidemiology, measurement of disease. What is the disease burden in community? So indicators also tell me what is the disease burden in the community. What is its distribution? Which group it is occurring more? When I study the two, I can look for determinants, and once I know what is the distribution, what is the magnitude, I can plan my health programs. So that is planning, implementation, and evaluation. These three phrases we in undergraduate we use together. So these are the uses of indicator, or this is how I put it across, and same are the aims of epidemiology. So what I am doing is bringing the knowledge from one, integrating within the subject. A lot of talk about integrating in between subjects and in between professionals, that is first professional and final professional, but I think we are still weak in integrating within the subject. Now types of indicators. Now types of indicators are multiple. So I will just read out the names. I may forget one or two, so you will find those details and specificity in my notes. These are mortality indicators, that is death, morbidity indicators, that is disease, disability indicators, and then fourth one, which is all these four are important and we will study in detail, are fertility indicators. And beyond this, you have to just remember name, you have to understand the concept, and you have to understand or give one example. So let us say nutritional indicator. BMI is a nutritional indicator. Percentage of pregnant women coming with anemia, number of stunted children, nutritional indicator. Environment indicators, the population getting safe water supply, population using sanitary latrine. What are the socio-economic indicators? Percentage living below poverty line. What are the health resource indicators? Doctor population ratio, patient population bed ratio. What are the health policy indicators? It is the GDP the government is spending on the health sector. Similarly, these are other indicators are there which I may not be able to. Health utilization indicators. It is the number of percentage of children who are receiving immunization. So if you remember, you have to understand the concept and understand and give an example. And if a NEET next asks you which type of indicator is this, you should be able to answer. So there is an example or the question comes, doctor-nurse ratio or population ratio is which type of indicator? So it is a health manpower or health resource indicator. How many, what is the population under each sub-center in actual? Theoretical it should be 5,000, 3,000 in tribal areas. But actual, what is actual? So it is a health resource indicator. But 4 we will study in detail. That is mortality, morbidity, disability and fertility. Fertility indicators we will not study here, but we will study under when we will go for MCH, that is maternal and child health. Because it is almost 7 minutes, so I'll stop here and my next video will be on, we will discuss in some detail mortality indicators, which gives lot of scope for numericals. And both NEET next and USMLE is asking questions on that. Bye for now.